Hey, this is Brooke, functional medicine dietitian specializing in fertility, and this is the Fertility Dietitian podcast, where I help you uncover the barriers that are preventing you from optimizing your fertility and teach you how to work with your body to finally take home a healthy baby. Each week, I will be diving into different topics on fertility and sharing my perspective on physiology, metabolic health, nutrition, and lifestyle approaches that have helped hundreds of couples get pregnant even after years of heartache. My goal is to empower you with the knowledge you need to take back control of your fertility. Happy listening. For today's client success story, I'm talking with Mari. Mari was diagnosed with endometriosis and blocked tubes shortly after her and her husband started trying to get pregnant. She was told that she needed to start IVF right away, so they went through a retrieval, which didn't result in any viable eggs, and she was told that there was nothing that she could do about egg quality. She didn't believe this to be true, thankfully. So she went on the search for support, and her and her husband ended up completing my group program in 2021. And then they reached out to me shortly after for private coaching because they knew they could benefit from a little more of a deep dive, a little more one-on-one coaching. She was 39 when we started working together in 2021. And I had the pleasure of supporting Mari through her IVF journey and her pregnancy. So tune in to listen to all of the details. Hello, everybody. Today we are talking with one of my past clients, Mari. I'm so excited that she is here chatting with us today. Welcome, Mari, and thank you for talking about your experience of working together.
Thank you for having me.
Yes, I'd love to hear what your fertility journey looked like before we met.
So before we met, we tried. We were trying for like a year, roughly, but not very consistently because we were moving, and also we just got married, or we were not married yet. It was just a very recent relationship, actually. But then, just before I started working with you, I got diagnosed with endometriosis after years that something was weird. I didn't have the typical symptoms of, like period pain or excruciating cramps. I just had a sciatica pain that was, I thought, we were moving and I thought it was just, I lifted too many boxes or something. And after I got diagnosed, I think I reached out and we worked together. First, I joined your group program and then your private coaching. And the only very upsetting thing is that they really push for me to do IVF. So my diagnosis also showed that my fallopian tubes were blocked, so they pushed immediately for IVF, and I was turning like 39, like the week after I had surgery. So I had my first appointment with the fertility clinic that was in the hospital that where I got the surgery when I was still in the hospital. Like I was still a patient of the hospital, so I was like in a nightgown and they were really pushing because I was 39. So my fertility journey was not very long before I met you. It was, I don't know, I think I spent 3 or 4 days like Googling and finding resources, and then I found you, and that was it.
Yes, and I'm so glad you found me. We started working together.
Me too.
We started working together in 2021, I believe.
Yeah.
Yeah, and you did the group program first.
Yeah.
And then we ended
Yeah.
up chatting and working in my private coaching program together, where we supported both you and your husband too. What sorts of tips did you learn from the group program?
So from the group program, I learned that I was not eating enough protein. So I stopped eating meat when I was 16. And I think I didn't eat enough protein for like 20 years at least. And that was, I've always had like what I considered a very healthy diet. I've always eaten a lot of vegetables, a lot of fruit, but not a lot of protein. And then another thing that really made me reflect a lot was how little I was sleeping. I've always had like troubles sleeping since I remember, since I was, I don't know, a teenager, or maybe, yeah, for sure in my early 20s. And I thought it was cool that I didn't need so much sleep, because the fact was that even now, like, when I don't sleep enough, and I rarely do now, I'm kind of okay. Like, unless it's less than 4 hours, I'm okay. So I thought, I had this superpower that I didn't need so much sleep. But no, that was, and it really, like, I really had to make an effort for both things, like to eat enough protein and to sleep enough, at least 7 hours.
Yeah, those are big foundations to fertility, as you've learned. And for those of you listening, sleep is our rest and repair period. So it's a big part of how our body's able to produce the hormones for supporting follicle development and ovulation and lining health. So it's a non-negotiable in fertility care for sure. And the protein piece, we're getting so many vitamins and minerals from our protein that are important for the quality of our eggs that we're producing, but also for things like blood sugar balance and what's happening with just energy throughout the day, how we're basically functioning metabolically as a whole, which trickles down to fertility in a lot of ways. So awesome foundations to work on there. What made you feel like you wanted additional private coaching support?
Because I realized that I had a lot of, I don't know if minor, but issues and challenges that I was not gonna fix probably by myself. And also, that's kind of the approach I have usually. Like, I tend to be pretty aggressive towards problems. So that sounded like the most hands-on thing. The main reason was, so we did that first retrieval just immediately after my surgery, which was, now I understand, completely useless. Just we just listened to what they were saying, but none of the eggs fertilized, and it was pretty, because I was super healthy and I was 39, but I don't think it was actually a big problem. So I thought, oh, my tubes are blocked. So once, that problem is bypassed by IVF, everything's gonna be fine. And none of the eggs fertilized. And when I asked the doctor, because they were already talking next time we can do this protocol, and maybe we can skip one cycle, you can go back on the pill. It was they were talking about everything medically, and I asked them, so what I can do to get my eggs in a better shape, and they say, I remember it was today, they just said nothing. You're 39 and that's how it is. So eventually one of the eggs is gonna be fine. So it was this is impossible. If you can somehow get less wrinkles if you do something, there must be something that you can do about quality. And then that's when I decided that probably they needed more support than what I thought.
That's so frustrating. It's unfortunately such a common thing that women hear, is that you can't do anything to change the quality of your eggs, and age is the main factor, or the only factor really, is the message that we often get to egg quality. And it's so far from the truth, which I'm so glad that you had that thought process that can't be true, and there has to be something else that I can do, because age is the one uncontrollable factor in a world of a lot of other controllable factors, at least to a degree, that we can shift what's happening with how our body's maturing those follicles and nourishing that egg quality. So once we did start working together one-on-one, what do you feel like was a couple of the biggest benefits of working together privately versus doing that group coaching that you started with?
Well, of course, the one-on-one attention, and also the fact that I could reach. I'm pretty anxious in general. And my whole fertility journey just made it worse. But the fact that I could, double check if what they were telling me was reliable or quote unquote true. It's, I think it made me feel more in control of the situation. To have somebody that I really trusted, and that I could, consult for pretty much anything. I think I told you before, you are probably the only medical provider that I truly, deeply trust, which is great, but also extremely concerning, because I've been to a lot of doctors, and only one, it's not many. But yeah, that was probably the relief of feeling that I could finally trust somebody and stop looking for answers and for ways to validate what they were telling me. We eventually changed fertility clinic, and it was much better, but still it was all protocols and timing, nothing about nutrition, or they recommended acupuncture, but that was about it.
So that's a start. Acupuncture is a start.
Yeah.
Yeah. I mean, I'm flattered that I was the main provider that you trusted. But yes, it should be, everybody should have a team of providers that they can definitely trust and rely on for a more holistic approach for sure. Unfortunately, that's not how a lot of our medical providers are trained, and just don't have that different kind of perspective to how to support the body, and help the body nourish fertility in the way it was designed to, essentially. Well, so when we worked together, we did some testing to kind of learn more about your body and where it's at and get a better idea of how to, meet your body where it's at and help it nourish fertility better. So, as Mari mentioned, protocols are a thing of fertility clinics, which I'm sure those of you that are listening that have been working with conventional providers are very familiar with the protocols. But the testing that we use when we work together one-on-one really helps us individualize that protocol. So we still work with recommendations based on evidence and, my clinical experience, but they're very individualized based on the testing that we do. What do you think, Mari, was the most helpful testing for you that we did together?
Whoa. I don't know. Maybe the GI map. Actually, I think it was my A1C that nobody thought about checking. Which is dramatic if you think about it, because I have PCOS. I was diagnosed with PCOS when I was, 22. And my OBGYN at the time, well, of course they put me on the pill because that's all they do. And imagine, basically 20 years ago, it must have been worse than now. But basically my OBGYN kind of made it sound like after my symptoms were gone, also PCOS was gone, magically. And that's actually another thing that I realized during the group program, that my PCOS was not gone, it was still there. So I brought it up both to my primary care provider and to the fertility clinic. And the first fertility clinic doctor told me, oh, it's okay, it doesn't matter because we are gonna basically force ovulation, so it's not a problem if you have PCOS. And nobody thought about checking, how I was metabolizing glucose. And turned out not so well. So, and of course, all the hormones made it worse. That was probably the most challenging physical part of doing so many rounds of IVF. But yeah, that was possibly the most. And the fact that you recommended that I was wearing, that I wore for a while, a continuous glucose monitor, that I'm still wearing. But otherwise, I would have been oblivious to what my blood sugar was doing. And now that I think I never thought about it actually, but now that I think about it, it's ridiculous that they didn't even think of checking it. There's not a history of diabetes in my family, but with PCOS, if you're trying to conceive, maybe it's not a bad thing to check.
Certainly. Yeah, that is a huge oversight. And I think speaks to the lack of education in women's health as a whole, and from fertility doctors, unfortunately, OBs, women's health providers as a whole, like there's, for some reason, a huge gap in education around what PCOS is, how it impacts things like egg quality, what you can do to change that and support the body metabolically as best we can. But blood sugar, so A1C is a look at how your body is balancing blood sugar over a few months. So it's like a longer term look, which is helpful because when you get like a fasting glucose, that's like a snapshot in time. Just right when you have that blood draw, you're learning at what your blood glucose is. But that hemoglobin A1C test is looking over a period of time. So gives you better insight for what's happening metabolically, and blood sugar balance is huge for how we are supporting energy creation, how we're maturing follicles, definitely a big part of egg quality, but also just hormone signaling in our cycle. So what's happening with estrogen and testosterone, which is important for whether you're ovulating at all, let alone the quality of the follicle that you'll be ovulating. So a lot of pieces to think about when blood sugar, and blood sugar is an important part of anybody's like metabolic health and fertility. It's A1C is something that I check in all of my clients' preconception panels, but absolutely a necessity if there is a diagnosis potentially in relation to blood sugar, like PCOS, with a history there. So yeah, that's definitely an important one to look at. And as far as continued learning around that continued glucose monitor that Mari mentioned is helpful to learn, like how her lifestyle habits and how her eating habits were impacting her individual blood sugar. It really helps us step away from those general recommendations around managing blood sugar and fine tune things even more, which is important when we're talking about supporting the body through fertility, but IVF especially, because when you bring additional hormones on board, it's going to make your blood sugar even wackier. So I guess, how many retrievals did you end up doing?
So we did 6 retrieval and 8 cycles. So for 2 or maybe 9, I don't remember. A bit short, maybe 9 or 8 or 9 for 2 or 3 of the cycles. We didn't get to the retrieval because I had like 1 egg, so we didn't go ahead with the retrieval.
Yes, and what do you think? What things do you think made the difference in the cycles that you did get egg retrieved?
Stress, 100%. I never understood how much. So I've always, well, not always, but for the last 15 years, I've been like doing yoga, and not just the physical practice, but also, like all the, I don't know, metaphysic part. I meditate a lot, but so I didn't really think that stress would impact so much my body, but it does. And for example, I can see it a lot right now, or like in the last, I don't know, 3 years, 4 years. every time I'm extremely stressed, my blood sugar goes up. Even if I didn't eat anything. Well, and during the night if I'm stressed, is just a disaster. But yeah, for sure, stress was the main component.
It's a big one. Definitely a lot of reasons that our body can be under stress too. Whether it's, not eating enough or eating inflammatory foods, like the diet piece can play a role in stress. Definitely added hormones, like the IVF process as a whole, not only like the medications itself,
Yeah.
but the appointments and just, the anticipation of it all obviously adds a lot of stress too. What strategies did you use to decrease stress for those successful cycles?
Baths. I was taking a bath every night with that
The minerals.
How do you say? Yes. Sometimes even more than once a day. And I thought that really helped. That was really beneficial. And then I was going for walks, trying to spend time outside, which is what I do now, apart from now, because it's like in the negatives. So not spending too much of time outside this week. But yeah. And at some point, like, my yoga practice was really not enough. Like, it was very hard to, I don't know, let go of all the thoughts that I had, and the type of meditation that I was doing was not beneficial anymore. I had to switch meditation. So it was, yeah, it was a lot of changes. I had to do a lot of changes to my day by day.
Yeah. And then you did get an egg and a healthy embryo. How did your first transfer go?
So basically, I never got pregnant, apart from the fact from the last time. And the reason why, or I guess one of the reasons why we kept doing cycles, is that every time it was a little bit better. So for like the second cycle, so basically the first in the new clinic, we got, like, I don't remember anymore, 2 or 3 eggs fertilized, and then 2 made it to blastocytes. So, and like, every time it was slightly better, slightly more eggs, slightly more embryo transferred, which was great, but also led to a bit of burnout. I think at the beginning of in the spring of 2022, like, we did 4 cycles, like, back to back. And it was because every time it was a bit better, so I was, like, thinking next time it's gonna be the right time, because they're getting always better. And that really impacted my body a lot. I put on, like, so much weight. in just 4 months. I think like 80 pounds is in pounds. I don't know exactly, but roughly. And it was not hard to make a choice, like, do I stop like doing IVF? Do I get on a diet and be of the weight that I've always been, or do I keep pursuing getting pregnant and having a baby? And I'm of course really glad that I didn't care how much weight I put on and how hard it was like to deal with the frustration of not getting pregnant. Because at some point, and I'm sure that people that are doing IVF now or that have done it in the past, at some point it's just like seeing like something that you really want, and it's almost a challenge with yourself. You get a lot in your brain, like in your head, and it's just very hard for a lot of reasons, but I don't regret it. I did.
Yes. Yeah. So Mari did have a successful transfer, and she currently has a 1-year-old. Yes. So talking about her journey in hindsight, for sure. Sometimes it's easier to look at it in hindsight. If anybody's listening to this and you're in the thick of it right now, whether it's IVF or just battling infertility in some capacity, it can be really, really hard to know what to do next. I think having a support team around you can be make all of the difference to help guide you. And so after those back-to-back retrievals, you did take a little break, right?
Yeah, I did. Because my mental health and my physical health were a disaster. Like, I really need to take a break. And I kept working with you. Am I the longest client?
No.
Okay, I thought I was. So I kept working with you, and the thing that I really changed after the last unsuccessful retrieval was that I started eating meat, which most of my family and friends were shocked, because again, I hadn't eaten meat since I was 16. But I remember I asked you, because my ferritin kept being low. My iron levels were fine, but my ferritin was low. Not dramatically low, but pretty low. So I remember I asked you, how much would it change if I did eat meat? And I'm glad that I actually changed my mind about meat. I was eating fish when we started trying to conceive. I've been vegetarian for most of my adult life, and vegan for 7 years. But when we started to conceive, I started to eat fish, especially when I saw how much protein I had to eat. But yeah, I think that was the last piece of the puzzle. And my ferritin has been great after that. And it was very weird, because it was very weird eating meat after 25 years, basically. And at the same time, I craved it. I think my body really knew that I had to to get some serious nutrition going.
Yeah. I think something that most people don't realize about how meat impacts ferritin, which is a form of iron storage. It's not just the iron itself, it's a lot of other minerals and nutrients within that meat that is supportive too. So, yes, the iron itself helps, but it's even more so like the copper and the zinc and those other minerals that are going to help how iron is moving into storage and out of storage. And we do get those other minerals from other foods, but they're harder for our body to use. So they're less bioavailable. And so it's going to move those markers less successfully as a whole. And iron is such a big, important process in the body. It's actually has like a regulation process. That supports how our cells are getting oxygen, how our tissues are getting oxygen. It plays a role then in blood flow to our ovaries and what's going to happen with how your body is using and responding to hormones or medications throughout an IVF cycle. Definitely impacts lining health too. So it's a big thing to pay attention to. So whether you are eating meat and just not eating enough of it, or if you haven't eaten it in a long time, it's definitely an area to think about in your diet and increasing as a whole. Awesome. So quite the journey to get to that positive pregnancy test. Once you did get that positive pregnancy test, how did things go through pregnancy for you?
Bumpy, to be honest. So I got this gestational diabetes diagnosed super early because I told them to check it. Because I knew, I could see from my continuous glucose monitor. And I was doing pretty well, so we moved when I was 7 months pregnant from Europe to the States, and that didn't really help the pregnancy. I don't know if, it was already a complicated situation. I had some higher blood pressure value every now and then. But after we moved here, we moved to an area where the altitude is pretty high. We moved to Colorado. So after a month, so the month before I got diagnosed with preeclampsia was very difficult. I couldn't breathe because of the altitude, and I wasn't going for walks because I was exhausted because of the altitude, and I ended up getting preeclampsia and spent the last month of the pregnancy in the hospital, which was extremely stressful. And they induced me at 34 weeks, which was incredibly traumatic. But now I don't care anymore. Our daughter is she was just very tiny, but yeah, she's doing great. So it was just a lot, but she's perfectly healthy. She's getting all to the milestone of her biological age, not the adjusted one. So it's all great. It was just extremely stressful.
Definitely. Yeah. Yes. So, risk factors for gestational diabetes, PCOS is definitely one of them. So we knew with the blood sugar management work that we were doing with Mari, like through preconception and through the IVF process, that, that was something needed to continue to watch out for during pregnancy. So the fact that she was tracking early on and got additional support for that early as possible in her pregnancy is definitely positive for, development of baby. Preeclampsia is definitely, altitude changes, travel changes are definitely going to impact those things. But having gestational diabetes is definitely a risk factor for higher chances of preeclampsia too. So I had the pleasure of supporting Mari through her pregnancy too. So we were doing the best we could to support her and baby, and get baby here safely as far as what we could do on our nutrition and lifestyle and support. So it's pretty awesome to see her baby girl thriving now. Lots of adjustments through the first couple years of life for everybody, including baby. And that it all came together and resulted in a happy ending, which is wonderful to see. Yeah. Do you have any advice for other women that are maybe in a space of wondering if they should add to their support team? Or what would you tell other women or couples that are kind of on the fence of adding some private support for nutrition and lifestyle?
I think it's probably the nutritional lifestyle is probably the main reason. Like it's probably the main focus somebody should have when trying to conceive. And I still don't understand why doctors keep giving recommendations on food or even lifestyle, honestly. Like they when I was pregnant and I was diagnosed with gestational diabetes, they sent me to like diabetes education, quote unquote, and it was like a joke. And I was like, yeah, I know, I work with a fertility specialist, thank you. Yeah, thank you. It was just so really like I guess my advice, sorry, I rambled a bit, but I guess my advice is don't trust too much what like a medical doctor is telling you about nutrition and fertility and lifestyle for fertility, because most likely they have no idea. Like I remember even when I was at the hospital, they wanted to give me like medication to sleep because I wasn't sleeping, mainly because they were telling me you can die any minute, which was an extremely dumb thing to tell a pregnant woman that is already anxious. But like they wanted to give me some medications, and then a specialist that they had in the hospital was like, oh no, those are horrible, I'm glad you didn't take them. But like the I don't know, the easiness or the superficiality, is that a word in English? I don't know. Like doctors are prescribing medications is just concerning. So I'm really glad that I got to work with you, because I don't think our baby would be on this side of the world if we didn't, because I would have just kept like doing a bunch of rounds when eventually would have given up, because I think we did it like maybe too many times, and at some point you cannot just, like, your body and your mental health cannot just take it anymore. So I would say that getting to work with somebody that is really competent and has results, because the results that you hear, like the statistics that you hear at fertility clinics, sometimes are not even live birth. They're just positive pregnancy test. So I think it's really fundamental. And also, like, probably another advice I would give somebody going through the same is just, things are not going to look the way you imagine them to look, but it's just for a period. Like, I think if I don't know, if I got really upset that I was putting on so much weight, and I would started going on a diet, which I think I ask you. Actually, I'm sure I ask you. I ask you, like, I'm putting on so much weight, like, what can I do? And it made so much sense. Like, you cannot really go on a diet when you're trying to conceive or when you're nursing, as I am now. So it's a matter of priorities. Like, for a little bit, your priorities are going to be a little bit different, and maybe your life is going to be a little bit different, your body is going to be a little bit different, but it's just for a moment. Like, and everything you do, like, so when I was pregnant, like, I had horrible food aversions to any protein, like fish, meat, eggs. Like, I didn't want to eat protein to save my life. And but I knew, because of course I was texting you all the time, that it was, better if I did. So I put yogurt on everything. Because, there's some things that are for such a short period that, I don't know, I guess you can make a little bit extra effort.
Definitely. Yeah. I love that perspective. Like, if you're struggling right now with, say, I don't know, the weight piece that you mentioned, know that it's just for right now, and your priorities might need to shift a little bit during the time that, you're trying to get that positive pregnancy test, you're trying to get baby here into the world, then you're nourishing baby while they're here. It doesn't have to be for forever. And sometimes that your lifestyle, and your sleep might look a little different for right now, but it's so worth it. And, having that support team that you can reach out to and, like, lean on for additional perspectives, I think can be really helpful as you're moving through all of these different stages of preparing to get pregnant, being pregnant, and, supporting your body postpartum time too. Well, thank you so much for sharing your story, Mari. I really loved chatting with you again. And I know so many are going to benefit from hearing your story.
Yeah. Thank you for always being there for me.
Of course. Thank you for listening to this episode of the Fertility Dietitian podcast. If you enjoyed it, please leave a review to let me know what topics you want more of or less of. If you want to keep learning, subscribe at Apple Podcasts, Spotify, or wherever you listen to podcasts. Check out my website for more info on my private coaching program, Master Your Fertility, for my membership community, Fertility Blueprint. And don't forget my digital store. Come say hi on YouTube and Instagram. See you in the next episode.